Lamellar ichthyosis is a rare skin condition you are born with. It makes the outer layer of skin become very thick and dry, forming large, plate-like scales that look a bit like fish scales. Babies often appear wrapped in a shiny, waxy membrane at birth, which later peels off to reveal the scaly skin underneath. The disease is caused by changes, mutations, in certain genes that help skin cells form normal skin. The most common gene involved is TGM1, but others like a BCA12 and NIPA-L4 can also be responsible. These gene changes are inherited in an autosomal recessive way, meaning a child must receive a faulty copy from both parents. Imagine two carriers, healthy people who each have one faulty copy, having a 25% chance of having a baby with the condition. Typical signs include thick brown-gray scales that may cover the whole body, very dry skin that cracks easily, heat intolerance. The child may feel hotter because the scales trap heat. Sometimes redness or inflammation where the scales are thick. For example, a child might constantly rub their arms because the skin feels tight and uncomfortable. Doctors diagnose lamellar ichthyosis by looking at the skin, taking a small skin sample, biopsy, and doing genetic testing to find the specific gene change. Treatment does not cure the disease, but it softens the skin. Frequent use of thick moisturizers or ointments, like petroleum jelly, right after a bath. Prescription creams that help the skin shed, keratolytics, or oral medications called retinoids that reduce scaling. Keeping the skin cool and avoiding harsh soaps. Think of it like regularly applying a rich lotion to a cracked wooden floor to keep it from splintering. You cannot stop the disease from occurring once the genes are present, but you can lower the risk in families. Couples who know they are carriers can get genetic counseling to understand the 25% risk. Prenatal testing, chorionic villus sampling or amniocentesis, can detect the mutation before birth. Pre-implantation genetic diagnosis, PGD, with IVF, allows embryos without the disease to be selected. These steps act like a safety net for families planning children. Recent advances include new oral retinoids that are easier to tolerate and work faster at reducing scales, research on topical lipid fat mixtures that more closely mimic natural skin oil, improving moisturization, early-stage gene editing studies using CRISPR aimed at correcting the